Hello friends, today we'll talk about how to take care of your AV fistula after surgery. AV fistula, once it is done, the incision is fresh. So after the surgery, you have to just take care that you don't wet it for another 24 to 48 hours, which are the instructions we usually give after the surgery. Now after 2 days, the wound can be left open or you can put a waterproof dressing and keep it covered for another 5 days. So that is enough. It is very important that you maintain the hygiene from of the fistula or where the fistula is made. So usually the patient says that we haven't wet it, the incision is there or the wound is there. But please clean your incision or the site of surgery with soap and water daily when you take bath. So the hygiene is very important. Nextly, visit your vascular consultant to check your fistula initially at the 3rd week and then at the 6th week to check if the fistula is maturing and how much is the development. Now, after your initial visits and you have started using the fistula for dialysis, it is required that you keep yourself under surveillance. That is, the fistula should be kept under surveillance by a monthly visit to your vascular surgeon who will scan and see the vein if it is increasing in size further or if there is any narrowing. Now the main advantage of this surveillance is to treat a failing fistula. Means if you identify any narrowing or any problem in a fistula at an early stage, it can be dealt very easily with some minimal procedures. Otherwise, if the problem increases, the fistula might completely fail and clots can form. Next, how do you take care of your fistula by yourself? Now, daily, whenever you take bath, after cleaning it, just check your fistula by looking at it, feeling it and listening to it. Now, take a look if the site of needling for dialysis are healthy or not. Is there any infection? Is there any tissue loss or any ulcer formation? Or if there is any bleeding that is happening? That is what you look for. Next, what you feel for on your fistula is feel with your fingers, put it on the fistula and feel if you feel the vibrations of the high blood flow. Your fingers should slightly raise up mildly, slightly, so that the fistula flow is good or not is known. Next, suppose you don't feel the vibrations but you only feel the thumb or the pulse over it, which is lifting your fingers very high, then it shows that there is some problem. Then you try to listen. Keep your hand close to the ears and hear the vibration sounds. Now, over a period of time, you will get used to the thrill or the bruit that we call is how good it is. Definitely, this requires some experience, but on a monthly visit to your vascular surgeon, you can learn it and monitor your fistula yourself at home apart from just doing an ultrasound scan. Thank you. Take care.